What's going on, guys? This is Bioman,
Dr. Rob.
And your boy Dave.
and today we're going to talk about the interrelationship between periodontal disease and systemic health. As we know, oral health is a huge concern in the world. That's why we have folks like you guys cleaning teeth every day. But what's news to me as someone that sort of is outside the dental space is that diseases in the mouth can affect other parts of the body. Talk to me a little bit about what's going on in forefront research where there's different parts of the body that are being affected by diseases and bacteria or whatever that's going on in the body or in the mouth.
So, your mouth is basically like the front door to your bloodstream, kind of. So, like, when you have bad oral health, I'm talking like plaque buildup, untreated cavities, gum disease, all of these things, that bacteria just doesn't sit in your mouth. As we know, the body works on a circulatory system. So that stuff can get into your bloodstream and cause inflammation throughout your whole body, affecting like your blood pressure, heart disease, heart attack, diabetes. All of these things could be affected just by not taking care of your teeth.
Yeah, and I think you highlighted the main ones, but I think there's a recent paper that just came out in the British Dental Journal in 2025, July 2025, that really delineates that relationship between systemic health and perio disease very well. I mean, the cardiac disease, blood pressure, atherosclerosis, and coronary disease, coronary artery disease. That's the highlight. I think that is constantly in the news. Like it is a point hammered home, and there's so many literature out there that specifies how the bacteria in the mouth is found in other parts of your body. Like the plaque that accumulates in your arteries have the same bacteria as what's in your mouth.
So I guess now with this new knowledge that we are seeing bacteria and different pathogens from the mouth transferring to different parts of the body, how do you think that's going to affect dental practice in the future and how they interact with physicians?
I think with patients being educated on like what your oral health can do with the rest of your body will cause a reaction to whereas though people would start taking more care of the oral hygiene, because the way I look at it, like it's not just about keeping your teeth clean, fresh breath, and white teeth. It's actually a preventative medicine. So keeping layman terms, okay. So proper oral health can stop you from having like high blood pressure or diabetes. It can help with it. So that's just what I think.
But I guess my question sort of comes to like now people are going to be taking care of their teeth more, but let's say they still don't and they go to a dentist and they start noticing other signs of systemic health issues. Do you think now there's going to begin to be some more dialogue between dentists and physicians now that there's a link?
So I think that you raise an interesting point. I think there's a very interesting how should I say this politically correctly? It's just there's always been a challenge of dentistry and medicine to communicate with each other. I mean, dentists do learn things about medicine, but not necessarily the medical students don't necessarily learn much about dentistry. I think it's just based on the curriculum that's set up. So there's an issue of awareness in the medical field. So I think organizations, researchers out there are really trying to pound on this issue that dental issues can affect the your body, the systemic health.
Right.
And it's, I mean, yes, we've come a long way, but I don't think patients are aware of this fact still to this day. And David and I see it all the time. There's so many people in this country. I mean, what? I think the population of the United States right now is about 380 million people, somewhere around there.
All right.
Like, there's a huge percentage of that population that just don't understand, have zero oral health knowledge, and their dental IQ is like a big fat zero.
Sure.
So more has to be done. I mean, it's alarming how people don't know this still.
I guess we're never going to get to the point where, you know, a patient comes into a hospital with a heart attack and the first thing a doctor is going to say is go see your dentist yet.
Absolutely. Like,
Right.
no.
So I think
Like,
that's sort of like
Yeah.
the delineation I also want to bring up, where now that we have this information that there is this relation between oral health and systemic disease, we can't overstep the boundary and start assuming that because we have these systemic problems, it's just because of the mouth. Like, correlation doesn't cause causation, basically, you know?
Absolutely. But, like, you know, the correlation's still something to
To look at,
monitor,
of course. Yeah.
right?
Yeah.
So I think for our tooth engineer audience is, like, we have to understand what periodontal disease entails. And I think the first level of periodontal disease, I guess, would be gingivitis, where it's just the gum is inflamed. That's it. Some bleeding happens, but the structural support of your tooth is still somewhat intact. Now, periodontitis is when your support structures, including like the bone surrounding your teeth, starts to deteriorate along with your gum tissue. So that's when you're really starting to lose, your gums start to recede and your teeth look longer. Is that, and your mouth, your breath stinks. What, am I missing anything else? Like what?
No, that's the main ones, yeah.
Calculus, so like tartar buildup. Like if you have a lot of it, like that's a problem. So like these are signs that you should be aware of. I mean, if you are at the gingivitis or the mild periodontitis stage, I think oral hygiene, like dental cleanings and scaling and root planings, are great like interventions. Stop it when you can, preventative health. But when you are past that moderate periodontitis into severe and terminal periodontitis, unfortunately, it's game over. Like, you know, our mission is to regenerate teeth, but we're not quite there yet. But that's where a dental implant therapy comes in, right? And David and I have talked about all four concepts, you know, implant dentistry to really restore all that. But it's just, I think the point we're trying to emphasize is don't get there. Really just take care of your teeth, brush twice a day, floss once a day, mouthwash once a day.
And go to the dentist.
Go to the dentist. Am I missing anything else?
And if you at that state, you probably should be going more often, like 2-3 times a year, for sure.
Yeah. The last point we should just briefly summarize is, okay, so heart disease is part of the systemic conditions that perio may cause, like influence, not cause, influence. There's endocrine systemic health related diseases.
Sure.
That's diabetes, metabolic syndrome, and then the respiratory system can also be affected.
I didn't even know that.
Right, I know. Like we're just superficially just going through this, so you guys are aware. The COPD, pneumonia. That's, I mean, the literature's there, like immune system, rheumatoid arthritis. That, I mean, I've heard that before. Your chronic kidney disease, renal system,
Alzheimer's.
Alzheimer's,
Another one,
like
yeah.
the reproductive system is affected, as well as the nervous system, Alzheimer's. Like you said, it's
Yeah.
just it covers like affects almost everything in your
Yeah.
body, which is alarming. So
So I guess, and again, another delineation here. Brushing your teeth isn't going to guarantee you from preventing all these diseases, but it is a factor that you can control in your daily habits to mitigate the chance of having any of these diseases.
absolutely.
Like brushing your teeth isn't going to cure everything, and we want to make sure our tooth
Just-
engineers and audience know.
Preventative measures. That's
Yes, this is a preventative measure, but there is a link as these bacterias are implicated in reaching these parts of the body that can cause these diseases.
Oh, and last point, if I may.
Yeah.
If you haven't brushed your teeth for 10 years and start now, that's not going to do it. Okay? So go to your dentist, get a checkup, get a treatment plan, and go from there. Because like 10 years of no oral hygiene and that you start brushing and flossing and doing mouthwash is not going to save
Brushing
you.
harder isn't going to help.
Yeah.
It's not gonna
Yeah,
help.
brushing harder, that actually makes it worse. So don't just brush harder. Soft bristles, always.
Yeah. Well, I think we've pontificated enough about this topic for a day.
That's a word right there. Is that a word? What? Pontificated.
Using that word is a pontification,
But yeah, that's all for today. It's been Dr. Rob.
Your boy Dave.
And Bioman.
See you guys next time.
Peace.